Dr. Monarez and Dr. Howry, thank you for being here today and being willing to provide this committee with information about what is happening at the Centers for Disease Control and Prevention under Secretary Robert F. Kennedy Jr.'s leadership. Despite his proclamations of radical transparency, Secretary Kennedy has consistently failed to provide information to Congress as he continues to undermine public health from his role in the Trump administration. You've heard from me before, having Secretary Kennedy in charge of the health of Americans is dangerous. And what we're hearing from you today really underscores this for me. Dr. Monarez, when your confirmation was before the Senate, I had my doubts that anyone in your position would be able to stick to the science and stand up to Secretary Kennedy as he compromises the health of the country in order to further his own ideas and agenda. I am pleased to see that you and other senior members of the CDC, like Dr. Howry, did stand up to him when the time came. You've both spoken about censorship and requests to compromise scientific integrity. Dr. Monarez, did Secretary Kennedy ever give you instructions on how you should interact with members of Congress?
He did. After the morning meeting, I became very concerned. I was alarmed that I was not being consistent. I would not be consistent with those areas that I had committed to this committee that I would do: transparency, integrity. And I had reached out to the committee to share my concerns. Secretary Kennedy became aware of that, and he was very concerned that I had spoken to members of Congress, and he told me I was never to do it again.
Congress and the American people need to know what is happening at the CDC, and this censorship is not radical transparency, and it is unacceptable. Dr. Howry, I was shocked to learn that you found out about the changes to the COVID vaccine policy on the social media platform X. Decisions like this must be made in consultation with CDC experts, because otherwise we are left wondering who is advising the Secretary of Health, or if his own conspiracy theories are enough to dictate who can get a vaccine. Dr. Howry, did you ever brief Secretary Kennedy?
I never briefed him. I accompanied him on a tour of CDC after the shooting.
Did your center directors ever directly brief Secretary Kennedy?
They did not.
You were the chief medical officer at the CDC. Would you say that it's harmful to the public if the secretary is not informed by experts like yourself?
Very much so.
How would you characterize Secretary Kennedy's approach to working with scientific experts at the CDC?
You know, we would have loved to have had the conversations with him. I offered to 2 different HHS leaders that we would like to brief the secretary. He never received that, and many times I would send emails to our leadership team to share with HHS when he did say things that weren't scientifically correct so that we could help support him. But again, our requests were not received to brief him.
So tomorrow, ACIP is set to discuss childhood vaccines. And based on what we've seen happening under Secretary Kennedy's leadership, we have to expect it will produce weaker recommendations for these vaccines. And at the same time, there is no Senate-confirmed CDC director in place. Secretary Kennedy has installed someone he is convinced will rubber stamp whatever decisions his anti-vaccine advisory members make as the acting director. In Wisconsin, there are currently 36 cases of measles, all in unvaccinated individuals, 22 of whom are children. I am thankful that we have not seen any deaths yet, as we have in Texas. Dr. Howry, you have seen firsthand in the ER what vaccine-preventable disease can do. what would an increase in vaccine-preventable diseases mean for children and families across the country?
It's going to be heartbreaking. Not only will it overwhelm our healthcare system, but children will have, some of them will be deaf. You know, we've seen congenital measles cases in the U.S., and I think what concerns me is these aren't harmless diseases. We just saw the case in California of a young child that died of encephalitis from years after measles. These diseases have long-term consequences, and we don't need, in the U.S., we have gone so far in reversing this. We don't want our children to die.